Today we'll be talking about bronchial hygiene therapy, which is our group project. Miss Tina is our lead RT, Jackie is our patient, and I am the recorder/narrator.
Our topic is cystic fibrosis. We are going to focus on vest therapy and discuss indications, contraindications, precautions, assessment of need, the monitoring of cystic fibrosis, common treatments, and there is more than one, medications, and we are going to show you on x-ray, a normal x-ray versus a cystic fibrosis x-ray.
Hi Jackie, I'm Tina. So today we're here to discuss some possible cystic fibrosis and using the vest therapy, which is a bronchial hygiene therapy. Cystic fibrosis, as you know, is a genetic condition which creates the lungs to produce some extra sticky mucus. This is a buildup and can clog your airways. It can cause inflammation and lung function over time. This condition gets worse. There's really no cure. Just long-term maintenance and early intervention is the best way. Jackie, do you have any family history of cystic fibrosis?
Well, my cousin had a baby. The baby at 2 weeks was diagnosed with cystic fibrosis.
Okay, by blood test or?
Yes.
Okay. May I ask, what race is the baby?
The baby is mixed.
Mixed, okay. The reason I ask is cystic fibrosis is more common in the white race than any other race. So that was just kind of a factor. Before we get into our bronchial hygiene therapy and the different vest types, we're going to quickly show you what an x-ray of a normal healthy lung and of a cystic fibrosis lung. We are going to get a chest x-ray on you. Plus, I just want to assess you with some problems that I kind of noticed in your chart you were having. Explain those problems to me. Like, what are you noticing here lately?
Well, I've been having a really nasty cough. And I've been
Are you
coughing
spitting
and stuff.
anything up?
Yes, ma'am.
Okay.
I am.
Really thick and color?
It has, and it's more like yellow.
Yellow? Okay.
I've been having some wheezing and stuff.
Wheezing?
Yeah.
Okay. How about shortness of breath?
Yes, I've been really short of breath.
Coughing up any bloody?
Just a little bit. Yes.
Okay. So right here in our x-ray, which we are going to show you, on the right here is a normal healthy lung. And then on the left is what a cystic fibrosis lung looks like. And like we said, this is a condition that you have long term. There is no cure. Your only cure is really just maintenance and early prevention to keep you from getting infections, which can cause scar tissue and lung function decrease, along with some other medical problems. So basically what bronchial hygiene therapy is it's a broad term to describe various airway clearance techniques. Both you can use at home or in the hospital. Ours that we, or the different types are the CPT vest therapy, which we have here, and we are going to show you, and I'm going to let you try it on and kind of see how you like it. We percussion, some vibrations. There's also some deep breathing exercises like some huffing, cough, and all that you can do also to kind of help you at home. We've chosen the CTV vest therapy because, of course, like I said, a patient can use it at home or in the hospital. And it's best used along with your bronchodilators, your antibiotics, and all that, because you're loosening up. Basically what this vest is doing is loosening up all that mucus that is kind of stuck and sticky. And when you use it alongside the medication, it just kind of works better to help you get it up and out to keep that from settling in your lungs and having pneumonia, plus along the other stuff. You can actually purchase one of these for your home.
And where can I get one?
Well, of course, you would have to have a doctor's prescription. And your DME company, which is like your home health company, can help in assisting in getting one and getting your insurance company to pay for it. First off, we're going to discuss some indications for use of it before I show you how to use it. You would want to use it like if you had a really bad cough that you felt like was really deep down and really thick, but you weren't producing much or wasn't coughing much up. Anytime that a chest x-ray shows that you have some mucus and is not really clear, because that mucus, it builds up on the inside of your lungs and your chest wall, and we don't want that, because that just sitting there can cause your infection into pneumonia, plus other things. So really, just like anytime, if you are diagnosed with cystic fibrosis, this vest just kind of helps break everything up, loosen everything. You know, in normal life, we could get it up, but a cystic fibrosis patient has an underlying problem that it doesn't break up like it normally would for normal people. The only thing is, there is some times that you would not want to use this vest therapy. You wouldn't want to use it if you have any broken bones, because it is going to shake you up. If you have any type of bone disease, you know, or as we get older, kind of frail bones, because that causes your bones to break easier. And if we're just totally shaking you up, if you're nauseous or vomiting or right after you eat, you don't want to do this. That basically is just asking for trouble to aspirate or any of that. Especially if you have a pneumothorax, we are not going to use this at that time. So of course, if you have any of those problems and you're having a problem with getting your mucus up, you would want to contact the doctor. Precautions and complications. We'll turn on this machine here in just a minute, but one thing is, it does get very relaxing when you're using it. Of course, you want to use it in an upright position, semi-Fowler's. We don't want you to use it laying down, because basically you're breaking up that mucus. So it does get very relaxing, almost like a massage to some people. Some people it's very aggravating. But overuse, you don't just want to turn it on and leave it on all day, because then you're steadily coughing up stuff that mucus is breaking up, which can cause irritation to your throat, more swelling, possible. Once you are loosening that up and you're trying to cough the mucus up, you don't want to obstruct your airway up top. So that's also another precaution you want to take is if you and your husband have kids, and now that there is a family history on your side of cystic fibrosis, you would want to have both of you checked and also have extra prenatal care, just because that family history, which means you could carry it on to your baby because it is genetic. Basically, I'm going to listen to you here in a second, but assessment to use the CPT therapy, we would get a chest x-ray. Of course, if you are having any type of loose secretions, we do want to do a sputum culture. Being that with that sputum being in there for kind of long periods of time that you can't get out, that's just a harbor for bacteria and infection. And you know, you're already having problems getting it up, and plus your body's already compromised because of the cystic fibrosis, that we don't want to just a long-term infection nagging. So we want to do early prevention. And also we want to do a sputum collection just so that we can know the classification of that organism to get the right the right antibiotic to kill that bacteria, to get you where you're not really down and have to be hospitalized. Cystic fibrosis you can live with. It's just you knowing the signs, the symptoms, and what needs to be taken care of ahead of time to keep you out of the hospital and to keep your lifestyle going and healthy, where you can just do everyday chores. Of course, with this, you're not going to be, you know, just like running up a hill, because, you know, you will probably get short of breath shorter just because of the problem. There is also medications, antibiotics, anti-inflammatories to help with the swelling of the bronchial and the trachea just from coughing up so much, and especially when you're really down and you've got a really bad case or a infection, you're going to have some irritation, which is going to cause your trachea and everything to be swollen. And we want to cut that down for you, because you already are having trouble trying to cough it up, and if you can actually cough it up, you don't want to keep your trachea irritated. We can do that by the inhaled medications, which like there's several medications, Pulmazide, you can mess along with the albuterol and everything that we can give you. That's kind of a dorfalcine drug to help loosen that even quicker. And when you use it along with this vest therapy, it just kind of helps break it up, plus the bronchodilator is helping you get the mucus out, which is what we want. we don't want to harbor it in there, just kind of growing bacteria and making your problems worse. Also, another thing that is important is nutrition. There is some oral pancreatic enzymes to help your digestive tract with your nutrition. Nutrition is a big time factor for cystic fibrosis patients, just to kind of keep your body healthy and eating right and all that. So your medications, I'm going to put on this vest therapy, but using this vest therapy with your medications is a big time plus. So this is a neat little vest. I'm just going to slide it around you. It is going to shake you up. Now, you don't have any broken bones. You're not sick, and you hadn't just eaten. Is that correct?
Yes, ma'am.
Okay. I don't want you getting sick, I mean. Sorry about that. And see, it's really simple to use at home. I mean, it's not like really wires and all that you have to hook up. It's a really, really easy thing for yourself just to do if you're home by yourself, or for anybody, for kids or anything, you know, parents can help them. But kids kind of find this kind of fun. It's kind of like a jiggle game to them. So I know you're kind of later in life getting diagnosed with it, but I mean, there is pure. So I'm going to have Jalissa come a little closer as we look. So you basically put the vest on, and we are going to turn the machine on, I think. You've got some different settings. You've got normal, you've got the, we're having technical difficulties, please bear with me. You can actually, oh, here we go. So you have your hertz, your, actually your minutes, and the kind of the vibration time. You don't want to get it too high because you don't want to shake a lot of it loose that you can't cough it up, where you cause an obstruction. Most of the time about 10 hertz, an intensity of about 7 with about 10 to 15 minutes. Usually about 15 minutes goes along with your albuterol inhaled treatment that you do at home to kind of help break this up. You know, every 4 to 6 hours is great. Just when you sit down to do your albuterol treatment, to use the vest at that same time if it's recommended. So I'm going to turn it on for you. It might shake you a little bit, but I won't leave it on long, I promise. So just kind of show you how it goes. It is going to play, and it is going to start vibrating. And what this vibration does is just kind of basically shaking you to help break up that mucus, that because you're a cystic fibrosis patient, you can't actually break it up on your own. Okay, we can't have you laughing. Just kidding.
Tickles.
I know it does. But you kind of got the feel of how that will help break it up over 15 minutes. And of course, along with your medications will be actually even better, just because you have the bronchodilator working as an inhaled medicine on your lungs, but you also have this kind of helping break everything up to help you get it up. Mm-hmm. Kind of a fun thing, huh?
Okay, I guess.
And simple to use. I mean, even if you're not feeling your best, it's still something simple that you can use at home.
Yeah.
I'm sorry, didn't mean to put it here. So basically, our monitoring, like we said, early prevention is best. If you feel that you're not feeling right, that you're kind of having more problems than normal with the breathing or kind of coughing a little more, maybe you feel like you've got stuff deep down in there where you can't breathe, but you're not getting it up. Those are signs that you want to contact your doctor early, because again, like I said, early prevention is the best. Cystic fibrosis is not curable, but we can basically calm the effects or long-term hospitalizations, multiple hospitalizations, and cut down on that infection to help you be able to live a life where you're not just kind of homebound or stuck down in the bed of the hospital. Again, like we said, proper nutrition, and proper nutrition is great also because with cystic fibrosis, you can also have some intestinal blockage. So you want to kind of keep everything where it's easier where you don't have all these problems that can go on top of cystic fibrosis. Cystic fibrosis in itself is enough So we don't want, intestinal problems and cystic fibrosis, your lung problems all together, because that just makes it worse in a patient. So if you have any concerns or anything, or you feel just you're not feeling right, even if you think it's something minor, early is the key to just keeping all your symptoms under control, and getting in with your doctor. So, Miss Jackie, we are going to get some chest x-rays to just kind of see kind of your baseline right now. And also we'll do some more lab work to make sure that you do have a true cystic fibrosis diagnosis. Do you have any questions for me?
No, ma'am.
Okay, well, I think this concludes our group presentation on bronchial hygiene therapy and CPT vest therapy.